Good afternoon. I'm Ellen Leahy. I'm the health officer for the Missoula City County Health Department, and this is the Friday, August 28th COVID update. Missoula County received 4 new confirmed cases of COVID since our report yesterday. Our current total active cases in Missoula County is 47. That's holding pretty steady. We have 255 close contacts that we are following up on that are being monitored for symptoms while in quarantine and being offered testing. There are 2 hospitalizations in Missoula County. One of those is about a Missoula County resident. The average number of new cases every day, averaged over a 7-day look-back period, is steady and with a slight decrease. But I want to remind you that when we look at these data, because of the incubation period of this disease, which can be as long as 2 weeks, plus there's testing in there to consider and the time for that, we're really looking at where we were in Missoula County 2 weeks ago. So that's good, where we were 2 weeks ago. But we have a lot of new activity in the county that I'll touch on in a minute, that we're going to have to be very careful with in order to keep that stability that we currently have. One of the epidemiological indicators that Cindy Farr and I and our epidemiological unit have been sharing publicly is the incidence rate among different counties, including our own county, and also statewide. So specifically, this is an incident rate that adjusts for population, and so it is how many active cases you have in your county over a 14-day period per 100,000 people. So that way you can look at small counties and big counties and really understand what the level of infection is, the incidence of infection, regardless of if it's a largely populated county or not, because it adjusts for that. So it's a much more useful measure. And we also now can look at that at the state level. So we compare our county's incident rate for active cases over a 14-day average to the states, and the states is 103 cases. Missoula County's is 19. So we are running below the state active case incident rate. That's good. Our transmission rate, also called the R effective rate, has continued to go down slightly, so it's staying below 1, and 1 is the demarcation that if it goes above 1, we're increasing the rate of spread, and if it goes below 1, we're slowing the rate of spread. So again, that's looking good. We continue to see most of our cases arising out of the 20 to 29-year-old age group. And that, of course, is very important information that certainly the University of Montana has worked very closely with us and in preparing the university's opening, which has now happened and is underway, because that particular population makes up a lot of the student population at any university. And also, the younger a person is, generally, the less likely that they will notice the symptoms right away. They may be so mild, but yet they would be contagious. So that's very important for us to know, that it's the 20 to 29-year-olds that still make up most of our cases. We have had a change, though, in which age group is producing the most contacts per case, close contacts, people that were close enough to the case that they were exposed to COVID in such a way that they do need to go into quarantine, be monitored for symptoms, and be tested, and that is a 14-day period. It's been interesting that in the last week, as we look at our data, it, we've seen an increase in the average number of close contacts in the 30 to 39-year-old age group. In fact, it's higher than the number of close contacts on average for the 20 to 29. It's up to 7.5 close contacts per case. So we would like everyone in that age group to know that and try to limit your number of close contacts, just as we've asked everyone to do, as well as the 20 to 29-year-olds. The other topic I just want to touch on, we did post our guidance for Missoula County for spectators at school athletic activities. School athletic activities are determined, first of all, by the governor saying that schools are allowed to open, and then with local school boards having local control, each board determines if they're going to open and in what way they're going to open. And when they open, those activities outside of class are considered part of that school experience. So the sports are going forward. That has not been the question. However, because people understandably, particularly parents, want to watch their student in sports, their presence makes it a group gathering that falls under the local public health regulations. And those are the same rules that we've been using since May, when phase 2 began. It looks at 6-foot distancing, how to plan, when you actually need an approved plan, how you can cohort people to try to slow spread and improve contact tracing. All of those same things that the county fair used, because we did not have a county fair that looked anything like normal, but they did find ways to select activities and go forward using those principles. We have had activities that were just too big to actually manage that type of structure. And we've had a lot of activities in the downtown in particular that have decided that they would rather go slower and smaller and keep the community safe, and have used that guidance to do so. So this is the first time we've had to align that guidance with school activities, and those school activities for the players don't have those kinds of limits. But if we want to have spectators there, we do have to have limits. So that guidance has come out. It is on our website, and it applies to all schools in Missoula County. It's fairly consistent with the other large 7 most populated counties that also have AA schools. It is not identical because each of those counties is facing a different epidemiological situation right now, and each of them are facing a different way, perhaps, of how their schools are opening, and different levels of resources and ability to respond to cases in the public health department. But we did coordinate to the extent that we could. So those are all on our website. The schools have them. And schools may go more restrictive if they choose to. Again, schools are operated under local control by local school boards, and some of schools are smaller and don't have to worry about larger numbers as much, and the larger ones sometimes will take a much more cautious approach. I would say all of our schools are taking a very cautious approach. And so as they start bringing in school activities like athletics, they have to at least meet the guidance the health department put forward if they're going to allow spectators. But they could go stricter. Anyone with questions about those, any school, they can call us at the Environmental Health Department, 258-4755. But this Spectator for School Athletics Guidance is already posted on our website and had already been delivered to schools. The last thing I'd like to say is, while we were working on trying to find the best fit between school decisions, Montana High School Association decisions for school-related activities, and local public health rules to get the best fit that we can, and it's not the fit we would all want to see. Everything looks different. But while we were doing that, I was really pleased to receive a number of really thoughtful, civil, informative, very well written emails, actual letters from students or their parents, and I want to thank the folks that engaged in that way. That was very helpful, and I want to commend you for your engagement, your thoughtfulness, and your civility. Thank you.